Hello and welcome to the Fitchburg Senior Center Patient Advocate Program. The goal of our program is to assist older adults in navigating the healthcare system and to empower them to be self-advocates. What is a patient advocate? A patient advocate helps people navigate the healthcare system through empowerment and education. They do this by listening to the patient's healthcare goals and wishes and partnering with them to ensure these are respected. A patient advocate collaborates with the healthcare team and family members and acts as a liaison as needed. They guide and coach patients, ensuring they have all of the information necessary to make informed decisions. Patient advocates help patients take back control of their own healthcare by reminding them that they are the ones in charge and that they always have choices. Here are some recommended best practices. The first recommendation is to be patient-centered. Ensure the patient's goals and wishes are known. Respect each patient's individuality and choices. The second recommendation is for informed decision-making. Confirm the patient understands the aspects of all options. Provide clarification as needed in simple language. Affirm the patient knows they always have choices. The third recommendation is empowerment. Do not do for the patient what they can do for themselves. The fourth recommendation is to educate. Encourage the patient to ask questions. Facilitate obtaining relevant information and discuss reliable sources. Lastly, coach and guide the patient. Do not make recommendations or decisions for the patient. Model effective communication with the patient and providers. What happens without a patient advocate? This is Mary. Mary is a participant of the Fitchburg Senior Center. Mary's medical history includes high blood pressure and diabetes. She currently takes multiple prescribed medications and is currently having difficulty with medication management. Mary's visit today is a routine appointment that was scheduled 3 months ago. Some of the concerns are dizziness, a recent fall, medication management, and nutrition.
Hi Mary, how are you?
Hi doctor, I'm fine. How are you?
I'm good, thank you. So how are you doing?
Pretty good.
Good. How about your meds? Have you been taking those regularly?
Oh yes.
Good. Any changes when you're taking your meds?
No.
None?
No.
Okay, I'm just looking over your med list here. You had told the tech that you have been dizzy. I thought I'd take a listen to your heart. So what's been going on with that?
Well, when I walk too much and do many things, I get a little dizzy.
Mm-hmm. Well, we might have to follow up on that at some point.
Okay.
But I think that for now we might just make some adjustments to your medications. And what about your blood sugars?
They're pretty good.
Have you been recording those?
Mm-hmm.
Any changes with your meds for your blood pressure?
No.
None. Okay. And none for the blood sugar either?
No.
Okay. Well, is there anything else you might want to ask me?
No.
Okay. Well, you have a good day, and we will follow up soon about the increase to your meds, okay?
Okay, thank
All
you,
right.
doctor.
Thanks.
You're welcome.
You can print out an after summary at the desk.
Okay.
Okay, bye-bye.
Bye-bye.
You've just seen what can happen without a patient advocate. Here are a few key takeaways. During the visit, the doctor asked several questions of Mary. Her response to most of those questions was no, effectively closing the door on any type of discussion. For example, Mary was hesitant to bring up the fact that she had fallen at home recently. Now Mary has a change in her medications, which may prove to be unnecessary. As you can see, the main concerns Mary brought to this appointment were not addressed. Now let's take a look at what happens with a patient advocate.
So Mary, before the doctor comes in, I think it would be good that we make sure we can write down all of your questions or concerns. Can you think of anything off the top of your head that you want to make sure to share with the doctor today that you're concerned about, or no?
No.
When we talked last week, just to kind of touch base and see how you were doing before this appointment, you had mentioned that you've been having a little bit of dizziness
Yes.
and that you had a little fall. You said it was kind of a slide off the chair and you know, you didn't really seem to hit your head or hurt anything. But have you noticed a little bit of dizziness since then?
Yes.
Okay. So maybe we should ask her about that.
Okay.
Is that all right if we mention that?
Yes.
Okay. The other thing you mentioned last week is you hadn't been feeling well, so you didn't make it to the center. And I know you usually lunch there.
Yes.
So how are the meals and the menu at home? Do you really rely on that meal at the center? It's kind of hard for you to get meals together at home if you're not there?
Yes.
Okay. So that could be maybe affecting your blood sugars a little bit or something recently. Okay. And you mentioned to me, I guess the one concern I have that I think it's important we should maybe bring up with the doctor is that at times you've been finding a couple pills in different places throughout your house.
Yes.
And I know you've been really good about being able to, keep track of your meds. Sometimes that can get to be a lot. But perhaps you're forgetting some here and there a little bit lately.
Could be.
Okay. Okay. Is it all right if we bring all these things up? I think they might all be pretty important for her to know.
Yes.
Okay.
Well, hello, Mary.
Hello, doctor.
Hi, nice to see you. And who do you have with you today?
The patient advocate, Dawn.
Oh, hi, Dawn. Nice
Hi,
to meet you.
nice to
I'm
meet
Dr.
you.
Amy.
Hi, Dr. Amy.
So, how are you doing today, Mary?
I'm doing fine.
Good. How have you been taking your meds?
I take them all the time.
And it's been going well for you?
Yes.
Okay.
Excuse me, Mary. One thing that we had talked about is, all right, you remember how before she came in we were talking about finding a couple pills sitting around?
Yes.
Did you want to?
Yes. I dropped some of my pills.
So, let me ask you a question. How do you take your meds? Are they packaged in a box? Do you get them delivered? Are they all in the bottles?
They're in paper.
They're in paper?
And they tear off when you want morning or night.
Okay. And are they dated?
Yes.
And they're packaged like that from the pharmacy?
Yes, they are.
Yeah. Sometimes it's easier for people to have pills in a med box that you don't have to punch out the pills, then you're not losing them. Is that what's happening?
No, they're in a paper. There's so many in each section. You tear them open and then you take them.
Have you ever thought about using a pill box? That might be something that you might want to try in the future.
Okay.
Okay.
That's
Great.
something I could help you get set up with. Mary.
Does that sound like a good plan for the meds?
Okay.
Yeah,
Yes.
then you might not be dropping them on the floor or finding them in other places.
That's true.
It's important that everybody takes their meds as prescribed.
Oh, yes.
So, I did see that you told the med tech that you might have been dizzy,
Yes.
and okay, well, we might have to just adjust your meds for that.
Mary,
Yeah.
before doctor came in, you had mentioned that you had a little fall last week and that you've felt a little dizzy since then. I think that might be important for her to know about.
That's very true.
Do you want to tell me about that episode?
I had a small fall. I fell off of the chair. I didn't hurt anything.
Were you sitting and then you were standing and you fell, or were you walking and then you fell by the chair?
I was sitting and then I fell.
Okay.
I didn't hurt anything.
Well, that's a really big risk factor for people taking some of your medications. So I think it's something that we should probably look at. Maybe getting some labs drawn just to make sure, the blood sugar and the blood pressure is all doing really well. And then, of course, we can check you out after we're done talking just to make sure that you're doing okay.
Okay.
And I have plenty of time for that today if we need to stay for to go to the lab or to
Yeah, you could
hang
stay
around.
for the
Yeah,
lab?
I can
Okay.
stay for that today.
Okay, I
if
would
we
like
need
to
do
run
that.
some of those tests. Have there been any changes with your blood sugar, and the numbers have been pretty good?
Yes,
Okay. And you've been feeling well?
I feel fine.
Okay. Because sometimes appetite and eating can change your blood sugar and not make you feel so well. So,
Do you remember what we talked about last week or what happened last week? when you didn't make it to the center all week and you said your counts were a little bit off with your blood sugars.
Yes, that's why I stayed home.
Yeah, you were staying home because you weren't feeling well because of your blood sugar?
Yes.
Okay, that would probably be another lab that we would want to run, and I can write up an order for that, send that down, so that might just take a few minutes after your visit today.
Okay.
All right, well, is there anything else you wanted to ask me?
No.
No? Anything you wanted to add in?
When did you want to see her back then?
I wanted to, well, I think we'll check back in about a month to go over
Okay.
her blood sugars. I also want to know if you've had any more falls.
Okay.
The senior center can refer you for a falls assessment to make sure that there are things inside the home, a home safety assessment to make sure that you're safe.
Okay.
So maybe that might be something you want to connect with at the senior center, or to have one of the social workers get her connected
Sure.
with that.
Yeah, I know Amy and Sarah quite well, so
Okay.
I'd be happy to reach out to them.
Sounds good.
Yeah.
Well, it's been nice, great service. Nice seeing you again,
Nice
Mary.
seeing you, Doctor.
Nice to meet
Nice
you.
to meet you,
All
Doctor.
right. Take
Thank
care.
you.
Bye-bye.
Bye-bye.
Now you've seen what can happen with a patient advocate. Here are a few key takeaways. They reviewed concerns before the doctor came into the office. The patient advocate took notes to be used during the visit. The patient advocate ensured that the patient's needs were met during the visit. Mary's concerns were effectively met, thus changing the direction of the appointment altogether. As you can see, what happens without a patient advocate can vary significantly versus what happens with a patient advocate. By following the recommended best practices, you, as a patient advocate, will be playing a crucial role in an older adult's healthcare journey.